Hello everyone, I am Sneha, lecturer, Department of Physician Assistant, SNS College of Allied Health Science. Today we are going to see about wound. Introduction. A break or opening in the skin is called wound. A wound is any disruption or injury to the living tissue. It can from trauma or disease. It will create a break or opening in the skin or organs, in the body surface or internal structures. Here is the image for the wound. There are many types of wound in our body. We will see one by one. First one is abrasions. Abrasions is the superficial scrabbing of the skin. The skin will scrap away superficially. Next is avulsion, tearing away of skin or tissue from our body. Third one is burns, damage from heat, chemical or radiation. It will affect our skin layers, dermis, epidermis and hypodermis. This depends upon the burns severity. Next is lacerations. Irregular tears in the skin is called laceration. Puncture, deep narrow wounds from pointed object. It will damage our tissue and skin. Next is surgical wounds. It is a incisions made during surgery by the surgeon. Here is the images for the types of wound. Next is pathogenesis. Wound can occur from trauma. It can be physical injury such as cuts, burns or abrasions, and also it is derived from infections such as bacterial infection, fungal infection, viral infection that can cause skin wounds. Next is ischemia. Reduced blood flow to the skin can lead to skin damage and wound formation. Next is systemic disease such as diabetes mellitus, vascular disease and autoimmune disorders can increase the risk of skin wounds. When the injury occurs, the inflammatory phase will activate, then the proliferative phase will activate, then the maturational or remodeling phase will cure the wound and it will transform our skin into previous time. Next is causes. The most common causes are trauma such as cuts, laceration, abrasion or punctures. Next is surgical incision. Planned cuts during medical procedure. During surgery, surgeon will create a cut. That is called surgical incision. The another common cause is burns resulting from heat, chemicals or radiation. It will affect our skin layers or tissues. Next is pressure ulcers. Chronic pressure may lead to tissue damage and also lead to skin wounds. Next is infection. Direct invasion by pathogens can trigger the wound formation. Next is chronic conditions such as diabetes mellitus or hypertension. Circulatory disorders, diabetes, venous insufficiency, immune deficiency, injury and tissue damage, mechanical pressure also lead to wound. These are all the common causes for the wound. Next is epidemiology. The prevalence estimated to affect 1 to 3% of the general population in the world. Next is incidence, higher on people with diabetes, vascular disease and autoimmune disorder, because systemic disorders can be a most common cause for the skin wounds. It will affect our system and also lead to skin wounds. It will affect our skin and also tissues. Mortality, skin wounds can lead to serious complications such as infection. If you are not treating infection properly, it will lead to amputation, and if you are not treating properly infection and amputated site, then it will lead to further infection and also in future it may lead to death. So skin infection mortality rate is high when we are not giving proper wound care. Next is clinical presentation. Symptoms vary based on wound severity and type. Pain, localized pain ranging from mild discomfort to severe and throbbing pain. It can lead to severe pain or mild pain, depends upon the wound location and also severity. If it is mild injury means it will cause mild pain. If it is severe injury, it will lead to severe discomfort and throbbing pain. Next common clinical presentation is bleeding. Bleeding or oozing from the wound is called hemorrhage. It can be depends upon the severity of the wound. Next is discharge. Discharge of pus from the wound may occur if it get infected. We should not we should not put our limbs down, and also we should take proper care for the wound. Next is smell. A foul odor from the wound may occur if you are not treating properly. The last one is itching or discomfort around the wound. Usually in the proliferative phase and also maturation phase, the itching is common because of regeneration of cells. If itching or discomfort is severe, we may see medical attention. Here is the image for proper dressing of the wound. Next is investigations. Clinical evaluation, assessment of wound size, depth and location and surrounding tissue, because we have to know the severity of the wound and also depth of the wound. Pain may vary, depends upon the location and also affected size and depth. Next is imaging, X-rays or ultrasound to evaluate the deeper structures. Next is wound culture, to identify the infecting organism, then only we can treat proper management. Next is blood test, complete blood count, C-reactive protein for inflammation, complete blood count to know the inflammation severity. Next is biopsy, tissue sampling for histopathological analysis to identify the organism.